ASD stands for Autism Spectrum Disorder. It is a developmental disorder that influences how an individual interacts with others, communicates, learns, and behaves. It is recognized as a developmental disorder because the symptoms usually appear when an individual is 2 years old and can last throughout their life. You probably know some people who are affected by ASD because it is pretty common. About 1 out of 36 children are diagnosed with ASD. It's also 4 times more common in boys than girls and is present in all racial and ethnic groups. You might be wondering, what are the symptoms of ASD? However, this is a difficult question to answer since ASD is a spectrum disorder. A spectrum disorder just means that symptoms and severity varies between individuals. According to DSM-5, for an individual to be considered to have autism, they must have persistent deficits in social communication and social interaction across multiple contexts, restricted repetitive patterns of behavior, interests, or activities, symptoms that must be present in the early developmental period, symptoms that cause clinically significant impairments in social, occupational, or other important areas of current functioning. Picture this. You are the parent of a 3-year-old girl who was recently diagnosed with ASD. Your child would often scream and cry when she wants something and is able to say only one recognizable word: juice. You would like your daughter to verbally communicate her desires with words, but you don't know how to help her. This is the reality that Mr. and Mrs. Williams and their daughter Tomika have to face. Tomika was eventually able to get help through training, which resulted in progress thanks to their interventionist. Mr. and Mrs. Williams made the right decision to diagnose Tomika at such a young age, but not everyone with ASD is able to get the quality of treatment that Tomika got. Many adults who have ASD could describe it as living life in constant chaos that is both exciting and overwhelming, or being expected to fit in without being able to speak their language or understand them. That's why you should try and diagnose as soon as possible to ensure that they receive the treatment that they need. The ASD diagnosis process usually goes like this. Since ASD can't be screened, a specialist, such as a developmental pediatrician, child psychologist, or occupational therapist, would ask parents to fill out a questionnaire. Then the results from the questionnaire will show the specialist the strengths and weaknesses of the child. The understanding of the autism spectrum has come a long way. Back then, autism was described as a form of childhood schizophrenia. German psychiatrist Eugen Bleuler was the one who discovered the concept of ASD in 1911. According to him, autism happens when one replaces unsatisfying realities with fantasies and hallucinations. And then in 1943, psychiatrist Leo Kanner wrote a groundbreaking report on children who displayed a set of unique characteristics. His work is what is considered to be the foundation of modern autism research. Remember how I said that people used to believe that autism was having excessive hallucinations? Well, in the 1960s, the definitions reversed, meaning that autism now meant having a deficiency of fantasies. To treat this, specialists used behaviorism, which was a popular approach at the time. This meant that parents would use rewards and punishments to modify their child's behavior. Another form of treatment back then was to follow theories. One such theory was the refrigerator mother theory. This theory suggests that children with ASD are emotionally cold and unresponsive due to a lack of maternal warmth. This led to a lot of parents being blamed for their child's condition. The recognition and understanding of autism is a lot more widespread today. However, we still don't know the primary cause of ASD, but that doesn't mean we can't treat it. There are many different perspectives on treating ASD, such as behavioral, which I already covered, developmental, social relational, pharmacological, and psychological. The developmental approach focuses on improving a person's understanding and use of language. This is often combined with the behavioral approach. The social relational approach focuses on improving social skills and building emotional bonds. The pharmacological approach uses medicine. Although there aren't any medications to treat ASD directly, there are plenty of them that can help those with autism function better. For example, it can manage energy levels, inability to focus, or self-harming behaviors. The psychological approach uses CBT, which focuses on learning the connection between thoughts, feelings, and behaviors. Thank you for watching. I hope you learned something new from this video and hopefully you got a deeper understanding of the autism spectrum.